Every year, the MLB spends over $1.5 billion on pitching, a grand total that is 5 times the salary of all NFL quarterbacks combined. In many ways, pitching is the most valuable commodity in the game of baseball, and by far the most expensive one. With that being said, pitching is also a high-risk investment for organizations. Numerous studies have identified overuse, high velocities, lack of rest time, and high workloads as root causes for musculoskeletal pitching injuries. It is an epidemic affecting pitchers at all age levels. Recent studies have shown that up to 58% of high school pitchers have experienced elbow pain at some point during a season. Other studies have indicated that approximately 35% of boys aged 9 to 19 years of age have experienced shoulder pain while pitching. According to Fangraphs, there have been 341 professional baseball players in North America that have undergone Tommy John elbow surgery between the years 2012 and 2016. Despite the reduction of elbow surgery cases over the past 2 seasons, the concern for pitchers' health only continues to grow. Moreover, it has been found that muscular fatigue can affect multi-joint kinematics and postural stability, which in turn can lead to poor pitch mechanics, decreases in ball velocity, and ultimately career and franchise-altering injuries. According to a Mulaney study, not all muscles fatigue at the same rate, meaning changes in muscle compensation can negatively influence their pitching mechanics, leading to an increase in injury risk. In this current study, Escamilla assessed changes in pitching biomechanics as a factor of increased muscle fatigue, and how these changes can decrease performance and increase the risk of injury. The experiment incorporated a sample of 10 collegiate-level pitchers who threw 15 pitches per inning for 7 to 9 simulated innings on an indoor throwing mound. The pitching session would conclude once the pitcher could no longer throw due to an elevated perceived level of muscle fatigue. A 6-camera 3D motion capture system captured the pitcher's biomechanics during the experiment. 20 kinematic and 11 kinetic variables were calculated throughout the 4 phases of pitching, most notably at front foot strike. Results showed that there was a significant decrease in ball velocity in the final 2 innings as compared to the first 2 innings pitched. Additionally, the trunk was significantly closer to vertical position in the latter 2 innings. While proving the existence of changes in pitching biomechanics as muscle fatigue sets in, more research must be done on the topic, and a variety of different variables must be considered. Type of pitch thrown during a game or even a season, muscular strength and conditioning levels, and rest time between pitch outings are just some factors to look at. Finding a quicker and less expensive way of collecting pitching biomechanics would also be very important to the field.